So today we are going to discuss about gout or hyperuricemia. So let's see. So what are actually the characteristics which define the gout? It includes severe pain, redness of the joint that is affected, and that very joint will become stiff as well. You will see that part of the joint will be swollen as well. And we know that swelling and redness and pain, all these three things are actually linked with one thing that is known as inflammation. And most of the times gout attacks usually take place at night. This is a pictorial presentation in front of you. You can see the redness, you can see the stiffness, you can feel the stiffness, and you can see the size of the gouty attacked foot as compared to the normal one. Next, we have the symptoms which are observed in the patients of the gout. So you will see that some of the joints of knees, toe, elbow, wrist, and fingers are involved in it. Obviously, there will be tenderness, there will be redness, there will be swelling, and there will be the limitation of the motion as well. Next, we have when to see a doctor. So if the pain is not getting away, if you are having the frequent attacks of the gout, then you must see a doctor, because it may cause very much or the irreversible damage to your joints. Next, we have the causes that are linked with the gout. So there could be three possible reasons for the gout attacks. Number one is the overproduction of the uric acid. So uric acid is actually produced from the purines. So if purines are high in the body, then it means it will lead to the high concentration of the uric acid. Now, if your kidneys are not available, are not working properly, then uric acid will be accumulated in your body. So number 2 point is the under excretion of the uric acid from the kidney. Number 3 is the accumulation of the urate crystals. So how the urate crystals becomes it will become through the inadequate excretion of the uric acid. Next, we have the risk factors. So number 1 risk factor is always related to the diet. So if your diet is high in purines, then it means you are going to suffer from the hyperuricemia, the gout attack one day. So if you're using the red meat a lot, shellfish a lot, beverages, and those beverages which have got the fructose sugar and the beer, so these are some of the stuffs which can provoke, which can evoke, or which can worsen the condition of the gout. Number 2 is weight. If you're increasing getting in high weight, then it means you're going to produce more and more uric acid, and when more and more uric acid is going to be produced, that means it will lead to the pressure on your kidneys, and your kidneys won't be able to get rid of that extra amount of the uric acid, and uric acid accumulation will take place. As a result, what will happen? You will be suffering from the gout attacks. Next is the medical conditions. If you're going through the hypertension history, if you're going through the diabetes, especially diabetes type 1, and heart and the kidney diseases, then there will be the problem in the clearance of the uric acid. Then there are some of the medication including beta blockers, ACE inhibitors, and the thiazide diuretics, which directly leads to the under excretion of the uric acid, leading to the accumulation of the uric acid, conversion of the uric acid into urate, and you know what happens next. It becomes a burden on your body and causes the gout attack to occur. So what are the factors related to the age? So congenital reasons may be there, genetic predisposition may be there, but number one thing that is more prominent in the female is that due to the reduced estrogen level after the menopause, women usually undergo or more prone to be under the attack of gout. So men of about 30 to 50 years of age and women after the menopause, due to decrease in the estrogen level, will suffer from the gout attacks more probably. And what are different methods to diagnose? So there are three methods to which you can diagnose the gout attacks. Number one is a joint fluid test. There will be aspiration of the joint fluid, synovial fluid, and under the microscope it will be seen whether that fluid contains uric acid or the urate crystals or not. Number two is the blood test, blood uric acid test. Obviously uric acid will be observed whether the uric acid is present in the high amount or not. Number three is imaging. Obviously the imaging will be done through x-rays, MRI, CAT scan, PET scan of your suffering joint, and if there is any problem it will be shown in the image. Next, the treatment protocols. Number one protocol is how to prevent or how to relieve the symptoms of the gout attacks. It includes number one, NSAIDs. So in NSAID, indomethacin and naproxen and sulindac, these are the three medications, three drugs from the NSAIDs class, which are actually selected by the FDA for the treatment of the gout attacks. Number two, corticosteroids. So you can get the intra-articular corticosteroid injections, but you can apply it or you can take it orally. It includes prednisone or prednisolone and methylprednisolone. Number three is the colchicine, but if you are taking the colchicine after 36 hours, it's not going to work at all. Then how to prevent the gout attack? Before we have seen that how to prevent the symptoms of the gout. Now we have to see how to prevent the gout complications of the gout itself. So number one is how to decrease the synthesis of the uric acid. So allopurinol and febuxostat, these are the two medications which are used to decrease the synthesis of the uric acid. Number two is a uric acid removing drug that contains probenecid. So it will cause increased clearance or increased elimination of the uric acid. Thank you very much for the listening.